Okay, good afternoon. At this time, we'll commence the Kern County Emergency Medical Care Advisory Board of August 14th. Program Manager, would you please call the roll, Jeff?
Thank you, Mr. Chairman. I'll be turning that over to my assistant, Danielle.
Thank you.
Chairman Flores,
Here?
Chief Linville,
Here.
Leslie Wilmer,
Here.
John Surface,
Here.
Orchel Crier, Scott Hurlbert,
Here.
Sheriff Youngblood,
Here.
Dr. Lyon,
Here.
Tyler Weitzel.
Here.
We have a quorum.
Thank you. Okay, at this time, we'll have our flag salute, and it'll be led by Mr. Hurlbert.
Yes, if you'd stand, please. Salute and pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you. That now brings us to our consent agenda. All items listed with the CA are considered by program staff to be routine and non-controversial. The CA represents the consent agenda for the board members of MCAP. Consent items will be considered first and may be approved in one motion. If a member of the audience wishes to comment or ask questions regarding an item or items on the consent agenda, they may do so prior to a vote being taken on the consent agenda. A member of MCAP may remove any item from the consent agenda, and it will be considered in listed sequence with an opportunity for any member of the public to address MCAP concerning the item before action is taken. Okay, we've all had a chance to review the consent agenda. At this time, I will ask for a motion.
Lyon, motion to approve.
Youngblood.
Okay, thank you. Motion second. All in favor?
Aye.
Opposed? Okay, motion carries. That now brings us to item 1, public presentations. This portion of the meeting is reserved for the persons to address the board on any matter not on the agenda but under the jurisdiction of the board. Board members may respond briefly to statements made or questions posed. They may ask a question for clarification, make a referral to staff for factual information, or request staff to report back to the board at a later meeting. Also, the board may take action to direct the staff to place a matter of business on a future agenda. Speakers are limited to 2 minutes. Please state and spell your name before making any presentation. Do we have anyone here for public comment? Now is the time. Okay, seeing none, we'll move on to item 2, board member announcements or reports.
Mr. Chairman,
Mr. Surface.
Jeff and I talked, I'm not sure where to do this. We'll do it right here. So a couple of weeks ago on a Wednesday morning, just before 11 o'clock, a paramedic ambulance in Roseman with paramedic Ken Robeski responded to a cardiac arrest. While Ken was on scene of the cardiac arrest, he went into cardiac arrest. And his partner and the engine crew from Station 15 did an amazing job providing CPR to 2 people at the same time until 2 additional ambulances arrived. Ken was transported. He did not survive. He is survived by a wife and a son. On Friday, August 29th at 10:45, he'll be laid to rest at the National Cemetery. And Ken will be escorted from the funeral home in Ridgecrest, where he grew up, to the cemetery by one of the honor guard groups and Hall Ambulance. And thank you to Chief Linville for offering to have a ladder truck at the funeral. But that'll happen Friday the 29th at 10:45.
Thank you, Mr. Surface, for sharing that sad news, and our condolences to you, the staff, and all the family members.
Mr. Chairman? Last meeting, we recognized my alternate, who was the Chief of Police of Arvin. He lasted 1 meeting. He's no longer the Chief of Police anymore. My question, Jeff, is can we remove him by putting him on the agenda, or how do we remove him so that I can pick another one?
Sheriff Youngblood, through the chair, what I will do is reach out to the clerk of the board. She is the one who handles that stuff, so I'm not certain of what the answer is, but I will reach out to her tomorrow first thing and get an answer.
Thank you.
Thank you. Any other comments? Seeing none, we'll move on to item 3 under Emergency Medical Services Program Requests, Manager's Report, Mr. Ferris.
Thank you, Mr. Chairman. So call volumes continue to be an issue for us in Kern County. Total EMS calls received and responded to in the first and second quarters of 2025 is 68,763. This represents a 2.46% increase from last year. It should be noted that as of right now, we are in the month of August, which has historically had the highest call volumes throughout the year. Based on the current average daily call volume data collected as of this morning, it is projected that our August call volume could be approximately 12,269 calls, which would be the highest monthly call volume since August of last year. Ambulance response time compliance for priority 1s and 2s, which are the lights and sirens calls, considered to be the most life-threatening calls, is at 94.84% for the first and second quarters of 2025. Kern County fire agencies are maintaining an average of a 10.10 minute response time to those lights and sirens calls as well. Our fire agencies and our ambulance providers are working well together to assure that proper resources are available for all patients in our county. As this board is aware, the use of lights and sirens drastically increases the chances of accidents and injury to our crews as well as the public. Currently, the estimated national average of lights and sirens responses for 911 calls is 74%. With lights and sirens transports at 21.6%. Kern County Public Health EMS continues to lead the nation in its attempt to protect our crews and the community at large, as well as providing the most appropriate responses to the patients in need. Currently, our lights and sirens responses represent 42.01% of all call volume, and our lights and sirens transport represent 4% of all transports with no reported negative effects on patient outcomes. Ambulance availability and staffing levels are increasing. Paramedic and EMT courses are ongoing at Saracoso College, Bakersfield College, Taft College, as well as Hall Ambulance Service, and are having a positive impact on our staffing numbers. The EMS certification team completed 803 EMT certifications/accreditations, 48 emergency medical dispatch accreditations, and 25 mobile intensive care nurse accreditations in the first half of this year. That is a total of 876 renewed or newly accredited field personnel. Policies, procedures, and protocols continue to be reviewed and updated. EMS is currently updating the ambulance service performance standards, the emergency medical dispatch policy, and the EMS quality improvement program, just to name a few. In the first half of 2025, our field crews made contact with our telehealth vendor 2,698 times. This represents a 251.76% increase from the same time frame last year. Of those contacts, 2,127, or 78.84%, resulted in no ambulance transport. While these numbers and percentages are very promising, they only represent roughly 3% of our total call volume. As a result, telehealth has now been mandated for all ALS providers and is being expanded to include BLS level providers as well. We continue to see large events in Kern County. Neotropolis was held on April 23rd through the 27th with 2,000 attendees, and they only had one ambulance transport.
On May 17th, the Luke Bryan Farm Tour took place for the first time in Kern County on select farms near Shafter. Attendance was approximately 17,000, and there were 2 attendees transported from that event. Bequinox returned to California City with 1,500 attendees and no ambulance transports. And May, of course, 21st through the 26th saw the return of our favorite lightning in a bottle to the Buena Vista Aquatic Recreation Area. 22,541 attendees were present. A total of 918 patients were seen by the on-site medical provider, Prevent EMS, and only 7 patients were required to be transported by Hall Ambulance Service to local hospitals. We have 2 events left this year. August 29th through September 1st is Echoes Festival at Democrat Hot Springs, which should host fewer than 500 attendees, and Wasteland Weekend in North Edwards, held from September 24th through the 28th, which we expect approximately 3,500 attendees. Our emergency preparedness team, which includes our Region 5 Regional Disaster Medical Health Specialists, or RDMHSs, have been extremely busy working with Region 5 counties to monitor and respond to a recent uptick in the H5N1 cases, as well as multiple regional unrelated hospital service disruptions. Our EP team is preparing and planning for the new fiscal year with new FEP and HPP grant budgets and work plans, which will include a new set of drills, exercises, trainings, and grant deliverables. And working with the County Emergency Operations Center, or EOC, as it transitions to a Type 3 credentialed center. Once this transition is complete, only properly credentialed individuals will be permitted to occupy a seat in the EOC. Community outreach and partnerships continue. We provide outreach with hands-only CPR, Stop the Bleed, Water Watchers, and Narcan administration. Our commitment to assuring exceptional emergency medical services remains unwavering. As we continue to face evolving challenges, our focus on training, resource management, patient care, and community collaboration will ensure that our crews maintain and provide the highest level of care. I extend my gratitude to this board as well as all the field crew members for their dedication and resilience. Together, we will continue to strengthen our system and safeguard the health and safety of the communities that we serve. That concludes my report, and it is recommended that you receive and file. I'm available to answer any questions.
Thank you, Mr. Ferris. Any questions or comments for staff? Okay, thank you for that report. It's time I'll entertain a motion in a second.
Motion. Staff's recommendation.
Surface second.
Okay, thank you. All in favor? Aye. Okay, opposed? Okay, motion carries. That brings us to item 4, APOT Task Force.
I will be handing this over to Bryn Kerrigan.
Okay, sounds good. Welcome, Ms. Kerrigan.
Chair and members of the MCAB board. As your board is aware, we've been meeting as an APOT task force for the entirety of 2025 so far. At this board's direction, I met with the hospital CEOs late last year. They designated representation from each of the hospitals to attend the APOT task force, as well as both ambulance providers and fire agencies have been present for our meetings. We have met monthly, and we have developed what we're calling the APOT strategic plan, which you'll find at your seats. The APOT strategic plan is really a compilation of the challenges that have been identified through the APOT task force over the last 6 months, with proposed solutions or objectives that we will work towards achieving that will hopefully address APOT here in Kern County. I'm not going to spend this time reading through each of them, but the focus areas are on public education, expansion of the APOT task force by inviting additional representation to the meetings, looking at field medical clearance for specific populations, looking at utilizing technology differently, looking at infrastructure and how it can be used differently, and then also looking at additional funding and resources. So the next step in this process will be inviting Antelope Valley Hospital to the next APOT task force meeting. They have recently been very successful in addressing their hospital throughput and APOT within their hospital. So we are hoping to glean some ideas from them on how they've been so successful recently. And then meeting with the hospital CEOs to show them this APOT strategic plan and develop subcommittees that will start working on the objectives to hopefully have a positive impact on APOT here in Kern County. Mr. Chairman and members of the board, that concludes my comments, but I'm available for any questions you may have.
Okay, thank you, Ms. Kerrigan. Any questions or comments for staff on APOT task force and strategic plan? Okay, so, well, good job and keep at it. And we wish you well and we wish success on this. You have a meaningful document with a lot of work product, and I look forward to hearing what Antelope Valley did and having stakeholder participation.
Thank you.
Thank you. And that also require a motion.
Motion to receive and file.
Thank you. Second, a motion and second. All in favor? Aye. Okay, opposed? Okay, motion carries. Short and sweet today. So that brings us to adjournment. The deadline for submitting public requests to the next MCAB meeting is Thursday, October 30th at 5 p.m. to the EMS program manager. And we'll adjourn to Thursday, November 13th at 4 p.m. here in the same board chambers. I'll just need a motion to adjourn. Motion. Okay. All right. We're adjourned. Thank you.